The next topic is role of nurse in elderly, home as well as institutional care. So these topics are very like self-explanatory topics. If a question is coming, role of a nurse in elderly, without studying anything, you can write by yourself, right? Care of an elder person. Okay. So role of nurse in geriatric care. So geriatric care is organized on a team basis. So needs of the patients are such that a number of professions and a whole range of services are required to ensure that these needs are met. So just one person or a particular department cannot take care or handle the geriatric persons. So number of professions will come together, as well as a whole range, so much range of services are required in order to meet the care needs of the old age persons. So what are the important aims of geriatric care? So one is to restore the elderly person to become independent, to restore the elderly person to be to the best possible degree to independent living. Second thing, to achieve quality of life which is acceptable to the individual concerned. So first one is independent living, and second one is achieving quality of life. So functions of nurse in acute care. This some of the points will be repetition. So in acute care, what all are the functions of the nurse? To gather the medical family as well as psychological history, to perform the patient assessment, explain the diagnosis and treatment to the patient as well as to the family, work closely with the patient, family, and other healthcare professionals. See, by reading the points, you can understand how easy it is. Foster elderly patients' independence. Maintain hydration, nutrition, aeration, as well as comfort. Provide medications and treatment to evaluate the response. And to evaluate the response of this medication and treatment. Administer emergency treatment when necessary. For example, immediately the person got a cardiac arrest. How we will manage a CPR? Immediately or suddenly the patient has taken some drugs unknowingly, increased amount of drugs, what we should do? So emergency treatment should be given based on the need. Initial discharge planning and coordinate referral to the community agencies. So whenever discharge is by admitting a person itself, we have to plan the discharge, as well as in case of there is disability or needed continuation of service, we can refer to any community agencies. So serve as patient advocate as well as inform doctor of any change in patient's conditions. So as advocate means they should get their rights as well as legal concerns. So that is all about acute functions of nurse in acute care. So in case of long-term care, similar type of functions only. Gather medical family as well as psychological history. Perform patient assessment and involve the patient and family in preparation as well as implementation of nursing plan or care plan. Promote the atmosphere that emphasizes quality living, not the disease and dying. We should not be made the person to think about the disease all the time as well as about the dying things. We should give the atmosphere like which can give the quality living. So ensure that patient receives medical, dental as well as eye care because it's long-term care function. So maintain hydration, nutrition, aeration, and comfort. This is same points. So provide medications, treatment. Here we can add rehabilitative exercise. In acute care, rehabilitation is not provided because immediate care. So in long-term care, we have to provide rehabilitative exercise and we have to evaluate the response. So teach and advise the patient as well as family, even the even about the medication, even about the diagnosis, the treatment, and the rehabilitative exercises. So perform emergency measure when necessary, same point. Serve as patient advocate, inform doctor of any change in patient's condition. So that is about long-term care. So finally, the community care. So identify the health, social, or economic needs of those persons. Refer elderly person to professional or agency which is best able to meet their needs. So explain diagnosis and treatment to the patient as well as family. Evaluate the compliance with and response to the treatment. So use clinic and home visits for health promotion. So teach and advise family and patient. Evaluate elderly person's ability to live independently. So become advocate for elderly persons. So these all points doesn't need any explanation. So that are the main functions. There are some more functions, gerontological nursing roles. They can these nurses can gerontological nurses can act as healers, caregiver, educator, advocate, innovator. So these are the roles. So continuation we can see in the next class, next video.